Hello, I'm Dr. Adriana Potter. On the Let's Get Physical today, we're going to talk about knee instability and how to recover from that. The knees are going to be bent, okay? Abs is going to be in, and you can always be doing some exercises for your arm. If you have weights, you can be doing this as well. So be creative so you can do more exercises for your body. But for the purpose of we're going to start with the hip abduction. You're doing, again, magical number to begin with is 10. As you're progressing and you continue to be pain-free, this will be like a week 2 for your exercise when you start with the closed chain. As long as everything that you're doing on the open chain is pain-free and you're not getting super sore, you're ready to move on to the closed chain exercises and on a week 2. Okay, and 10. Then we can do the squeezes, and then you're doing 10 times. That's the magical number in here. 9 and 10. Alrighty. Now, when we're doing the bridges, the first thing to watch it, to do it, and I like the block because it will guide you, is that to make sure that your knees doesn't go inward when you're doing the bridges. We want your knees to stay out. So 2 ways you can do it. You can pull out on the band, keep the band open, and then you raise your hips with the band spreading and down. Pull out on the band and raise the hips, and the abs are also engaged with this. And you're doing your 10 bridges into supine with that open chain, but it's not full weight bearing yet, okay? If you have weight bearing restrictions from your physician, you're going to respect that and progress according to his direction. But once he allows you to do partial weight bearing, you can do this second level of exercise of the closed chain on your back. And everything on the open chain you can always do even if you have weight bearing limitations. And 10. So I said you can always use the block, but you're not going to be squeezing. You're just using the block to guide you, so your knees doesn't go inward. Usually it goes inward because your hip muscles are not strong enough. So 2 ways you can control that motion to not go inward is using the band or using the block. Either way is fine. Alrighty. The next one would be you doing a mini bridge and you try to kick the leg straight and come back. Kick the leg straight and come back. Kick the leg straight and come back. The nice thing about the block is that if you're dropping or doing it, you can see how the block moves all the way around. We want this to be nice and straight and they're staying stable, and you try not to drop that block. So that's a nice visual cue to allow, and you don't have to be super high into the bridge to do a little bit of this marching, okay? And if you getting the leg straight is too much, you can just do a little bit of the marching. But the key is to use your abdominal muscles and your glutes to keep that block not wobbling as much. Alrighty. So the next level, assuming that you're pain-free by the end of week 2, you wanted to move to something a little bit more strenuous, is actually doing a mini bridge with one leg. And you're doing that, you will look like this if you're doing and you can keep the other leg into the quad set with the knees straight. And you're doing just a little bit of the hip thrust to get that strengthening at the hip level, but you're getting some work as well on the quadriceps and other muscles. We also have the use of the Swiss ball to do a little bit of the hamstring curls in here, or just a hamstring set, which is dig the hips down and let it go, dig the hips and let it go, dig the hips, let it go. 5, 6, 7, 8, 9, And then you can do with the heel digs without lifting the hips. Hip stays down. You dig the heel, curl the leg, and down. So your leg is pressing down the ball the whole time. It doesn't have to be super strenuous. Just kind of getting a little bit of work into the hamstring in here. Dig. This is 4 and 5. Pain-free. Alrighty. Sometimes in the first couple repetitions, you have a little bit discomfort. As you keep going, that discomfort should decrease. If it's staying bothering you the whole time or increasing, this is not working for you. You need to stop and seek the help of a physical therapist. I think this is 10. And then we can do one leg digging. Put this leg here. Dig and curl and that. And I encourage you to do single leg stuff because sometimes we don't realize how much of the weakness on the weak leg because your strong leg helps you too much. So when you're doing single leg work, you will notice the difference between your right and left side, and the imbalance of strength or flexibility also will affect how you're performing on your daily activities or sports activities. I think this is 8 and 9 and 10. Now we're gonna move on to do a little bit more things in standing, okay? The first thing you wanna do is see what's happening when you're getting up from the chair. For the purpose of this video, I have aligned a measuring tape to the center of the knee, and you can see how this is going to the center of my foot, the end of the tape, and the top is to the center of my hip, okay? And I'm holding this still. When you're having weakness, what's happening there, you're gonna see your knee going inward, and you can see how the center of that tape is no longer over my foot, but it's going actually to the center of the body. And then you go down, you can see how the knee goes inward and the pressures are there. So this is a classical position that you're gonna see that patella subluxing or dislocating towards the outside of the knee. That's the most common pattern. It can happen the other way around, but more often it happens because you're having this poor mechanics of that alignment of the hip. So you wanna keep the center of the knee over the center of your foot, and your foot's going forward, not turning out like this or turning inward. You wanna keep straight forward, right? As you're keeping this forward, you can see how he stays aligned with my hip and the center of my foot, okay? And you go up and down, and you keep keeping even weight. You're not seeing that shifting towards the strongest leg. You want your butt to be in here, because if you're here, you can see how the tape will measure, it will kind of move there. So this is a nice visual aid for you to see how you can do a little bit of that correction. So doing this exercise in front of the mirror is very, very important to kind of do this sit to stand exercises. And that's for the week 3, probably, as you're getting from open chain, which is a non-weight bearing exercise, to partial weight bearing on the closed chain exercises, and now you are full weight bearing on closed chain exercises on the sit to stand here, right? The next one you can do is actually just going with just kind of going up and down, doing single leg balance. There's the next one. So let's finish the calf raises in here. Nine and 10. And now we're going to start doing some single leg balance. And the most important thing is to notice what's happening here at your hip. So as you shift your weight to your right and left, you can see how the knee, it will kind of lock a little bit, okay? And when we're doing some of this standing exercise, you want to be able to bounce your knee in here. If you're completely locked And a lot of people tend to stand with the knee really locked, and it kind of goes backwards even more. I don't have the hyperextension in the knee, but a lot of people with knee instability tends to stay locked and the knee start bowing more into this position in here. We want to avoid the hyperextension in there. But as you shift your weight, you want to be able to still balance in here and do a little bit of that single leg balance and start practicing that balance on the steady surface in practicing that for as long as for a minute if you're able to, and just standing. So that's an easy one to do it. I always tell my patients that practice your balance while you're brushing your teeth. You have to do twice a day. Once your leg gets fatigued and you feel like that burning sensation happening in your calf muscles, in your knee, you're still able to balance in here. And it has to be pain-free. I don't want that knee to be locked. I want the knee to be slightly unlocked, because that means you're using your muscles. And you might be wobbly all over, but you're trying to control the knee to stay over the center of the foot, not going inward like that or not going that way. So you want to kind of stay nice in the middle of the foot. If you're wobbling, that means there's a lot of weakness and instability going on the ankle. This is going to build up some strength at the level of the hip, knee, and ankle, and also the intrinsic muscles of the foot. Alrighty, so you practice about 30 seconds or more on each side, and you do that for 30 seconds each, twice in the morning, because you need to brush your teeth twice a day for 2 minutes at least. If you brush them more often, you can practice more often as well. That way you can do 2 things at once if that's what you want to do. Otherwise, you just practice this as an exercise solely, and you don't just practice in them. Okay, so you do both sides. The next level, that if you feel like this is not very challenging, is start a little bit of the drives for your balance. It start becoming a little bit more dynamic, and this is full weight bearing and no pain. So we can do this. The knee is bouncing, it's not locked, and you're doing this hip abduction 10 times, pain-free motion. The standing leg should have no pain into the knee. Again, if you're having pain, this is not working for you, and you should be working with the supervision of a physical therapist to modify this exercise for you. I believe it's 7 and 8, 9, and 10. You're going to switch to the other side for 10 times as well, because then you're going to notice, oh yeah, my right side is a lot easier. I don't feel as much. And you want to be engaging those abdominal muscles as well. Okay, so 5 and 6, 7, 8, 9, and 10. And then we're going to do the forward drive in here. And the knee wants to go inward. Try to correct that. Keep that over the center of your foot. If this is too easy for you, you're ready to move on to the next level of exercises, which we will get in a bit. So you can forward if you wish to. But right now, this is the level that we are working in here. And then you do the same thing and control. The knee wants to rotate a little bit, and that's bad. You want to keep the knee over the center of the hip and the foot. And if you're not sure, do the tape trick, whether it is a string that you attach and make a straight line, or just visually correcting the motion for that. And the next drive we have here for the leg is the back kicks. I'm going to turn sideways, and you don't want to be bending forward a lot. You want to be nice and tall, and the motion is small. So you're feeling that glutes squeezing, and your heels going straight, not turning out, staying straight. And you're doing those back kicks in here for the knee stability. So that is the leg drive. And if that's not getting to your muscles in terms of strength, this is a combination of balance and strength, getting you ready for the next level, which the band exercises. We're going to add the band to this. So you're going to just hold on your horses. We'll get to that in a second. And 5, 6, 7, and 8. Or maybe you go up, up, down, down. So the left leg is going up, and you do this for about a minute. That's the forward step ups on level 1. So step up and down. If you have risers in your step, you can increase the risers basic, depending how much strength you want to work. So you have the first level, 1 riser or 2 risers, okay? But if you, once you get to the higher level of your riser, you want to again monitor to avoid this, keeping that foot straight, and you're doing this step up nice and controlled, and you're gonna do the drive going up with the left, and you're just alternating, and then you reverse and do the driving leg being your right. Okay, so that it is just stepping up and down, and then you can do the same thing, step down, down, up, up, down, down. So you're doing your side steps, and you also controlling, preferably doing this in front of the mirror so you can see what that knee is doing. Start with the lower level and gradually get yourself to the higher level. If you jump too much to something that is too advanced, guess what's gonna happen? Yeah, you're gonna have pain or too much muscle soreness, and then you're gonna have to back off from your exercises. So progress slowly so you can gradually get there without having any flares and backing off from your program. Okay, that's the side steps. And then you go back to the lower level again, because we're gonna do something which is eccentric control. So we're going up, we're creating concentric control. So going up the stairs, always gonna be easier than going down the steps. Going down the steps, we're fighting the gravity, because gravity wants to push you fast. So you want to control that motion, and that's called eccentric. It's being when the muscles are holding on the contraction and gradually letting it go, gradually lengthening to allow the motion to happen. That's called eccentric work. The muscles are lengthening while controlling and letting go the contractions, okay? But it's a controlled motion. So going down the steps, more often people have pain with that motion than going up the steps. If you haven't been going down, this is going to be difficult for you. Build it up with other exercises, and eventually you're going to get to stepping down. But if you're going this way forward, so you can see my foot going down that way. All right, so the eccentric work, you're just doing the opposite. You're doing the step back works, and again a little bit of that eccentric control. Okay, if this is too much, you can do dip, dip, and if this is feels like, yeah, that's my level, you stay with no levels. Dip, dip, and watch for your body to do this, kind of you're reaching down. So it's like reaching down with the hip, so you don't want to bend on the knee. So that's a bad thing because your hip is lowering it. You want your hip to stay level. Okay? So that's the stepping down control motion. Step down. If you're finding that you having a knee is buckling on you, this is the one to work with. Okay? So you go up and down, up and down. The knee wants to go this, remember? Correct it. Keep that in the center. Go up and down, up and down. So we're doing the concentric, eccentric work, but you're gonna see a little bit more of that wobbliness happening here. And you can go to 1 risers, 2 risers, and kind of working to the level of the dips, to your desire to build up the strength and increase the range, because if it's longer, you're gonna be doing more. Or you can do very, very, very slow. Very slow. Slower with control.
I hope you enjoyed the video. Don't forget to subscribe. I'm Dr. Adriana Potter, and Let's Get Physical series on knee stability. Enjoy, and don't forget to press that bell button to get reminders for your subscriptions and the videos in the future. Have a great day.